This is the InstaClinic of Dr. Wassim. Please be advised that some medical imagery may be unsuitable for young viewers. The doctor will see you now.
Today's InstaClinic comes to you from a very, very hot Mumbai. Today we'll be talking all things eyes. We'll be talking about dark circles, tired eyes, loose eyes around the skin, eye wrinkles, tips and tricks on how to rejuvenate the eyes. And I'm joined by my very, very special guest and dear friend, Dr. Sabrina, who will answer questions alongside me.
Hey Wassim, thank you so much for this beautiful InstaClinic. You're in my hometown of Mumbai and I'm in London. I'm sitting in my beautiful clinic at Harley Street and I'm going to be talking all about eyes.
Thank you, Sabrina. It doesn't get more international than this. This is the international InstaClinic from London to Mumbai. Let's kick off with some questions. So our first question is, my friend had under eye fillers and has developed sausages under her eyes. What's going on? Is this permanent?
So, InstaClinic is on and we're talking about Mumbai's and eyes all over the world. So the first question is, my friend had under eye filler and now has sausages under the eyes. Oh dear, that's an bangers and mash meal and we don't want to have sausages under the eyes. The question is this permanent? So under eye fillers can migrate, and because the under eye skin is so thin, they can often cause these little sausages or speed bumps under the eyes that are really visible. It's not permanent if you have a little quick fix with a dissolving enzyme, which is hyaluronidase. Small little injection to dissolve the filler and the speed bump or the sausage just disappears.
So question number 2, I was hoping to show you some sunny Mumbai, but it hasn't quite worked out as I'd planned. The question is, do you have to wait for tear trough filler to fully dissolve before having further treatment? Sabrina?
So question number 2, do you have to wait for tear trough filler to go fully before having more? Absolutely not. If your first tear trough filler is sitting well, looked great and didn't cause any problems, that means no sausages, no swelling under the eye, then don't wait for it to completely disappear because that's not required. It takes forever to completely disappear. We just gently layer on filler after filler so that the under eye hollow gradually gets better. And if you wait for it all to disappear, you'll just be starting from ground zero and you'll have more of a spend.
Our next question. What is the best and most effective way to treat hyperpigmentation under the eyes? I think Sabrina is the authority in this, so I'm going to let her answer this question. Over to you, Sabrina.
So question number 3 was, what's the most effective cure for hyperpigmentation? And I had to come into my waiting room to show you my little goodie box here of things that can work under the eye. So the first thing is to protect under the eye. And I can't tell you how important SPF is. My 2 personal favorites, IS Clinical SPFs. You must protect the under eye area and apply the SPF and top it up. Then you need to actively treat and maintain your treatment. So what are my 2 hero products? I have the Skin Better Science Interfused Treatment Eye Cream and I have the Youth Eye Complex. And these are great for under eye hyperpigmentation, just like, think like you're brushing your teeth and putting the correct toothpaste on top. So this is what you need. It's a cocktail of antioxidants, vitamins, and copper tripeptides, and the most important vitamin, which is vitamin C, with low grades of retinol. And this one also has caffeine, so great for puffy eyes. And then finally, once you've sort of done this protect and maintenance kind of plan, we need to actively treat. And there are lots of treatments for hyperpigmentation. One of the top treatments I have in my clinic is under eye peels. This is a great season to do under eye peels. Winter is fab. The Enna peel, I really like the Enna peel under the eye. It's a very gentle peel, but you need a peel every week. You need a minimum course of 6. I do mesotherapy with vitamin C, with Tixil, which is great for tightening under eye skin and treating hyperpigmentation. And those are the treatments I offer in the clinic. Dermal fillers are great, but not for hyperpigmentation. But we do have dermal fillers that have glutathione and a cocktail of vitamins, and this can potentially help hyperpigmentation. And so one of my top favorites is Redensity 2. And so one of my top favorites is Redensity 2 from Teoxane, which is what I use in the tear trough.
I'm embarrassed now to be transmitting from my hotel room, which is not as clean and tidy as Sabrina's closet. But I wanted to say that I also agree with Redensity 2. It is the only product I will ever use underneath someone's eyes. It has just the right amount of hyaluronic acid, the right consistency to fill the under eye areas without creating sausages or migrating. But more importantly, it has something called DRC in it. And the DRC is a very, very potent cocktail of antioxidants, amino acids, minerals, and vitamin B6. And these are all sort of skin nutrition. They're very, very good for rejuvenating the under eye area, for protecting the under eye area. So yes, that is also my first choice. The next question is, do tea bags work for the under eye area? I'm sporting 2 masala chai tea bags as I'm in Mumbai, but presumably they have to be wet for the process. Sabrina, could you please shed some light on this?
Hi, I'm back. So I've had an entire day working my socks off at Harley Street, and the questions are still coming. Wassim, what are you up to? But I'm glad it's generated so much interest. So what's the next question? Do tea bags work for eye bags? And if not, what can you recommend? So tea bags are a good home remedy. It's the caffeine that you apply topically on the tea bags that depuff puffy eyes. And it works exceedingly well for eye bags that are due to allergies, because it's depuffing the venous congestion. It's vasoconstricting the blood vessels, and therefore it can work temporarily. It's not a permanent fix. So if you want to get up every morning and apply tea bags and every night put tea bags on your eyes, be my guest. A permanent solution is surgery. You just want to get those eye bags removed and repositioned around the hollow, or you can mask fillers or fat transfer.
The next question is, what can I do about crow's feet and heavy, loose, sagging upper eyelid skin? There's another question further down, so I'm going to kind of merge them together. The other question is, could you tell us about an upper eyelid blepharoplasty and what the downtime is? An upper eyelid blepharoplasty is an operation where the excess skin is removed from above the eyelid, one of Sabrina's specialties.
Right, so some more questions. What do I do about hooded upper eyelids and these crow's feet? Okay, so the first thing is for crow's feet, you can have some botulinum toxin injection, particularly for the dynamic crow's feet. That means, when you have these lines that occur when you smile, that's when you want to consider some Botox, and it's a temporary fix, and you need to have it sort of every 3 to 6 months, depending on how long it lasts. If you're much older and you have static wrinkles, that means even when you're not smiling, you just have these, lines. You may want to consider hydrating fillers like skin boosters, Redensity 1, RHA1, all these kind of wonderful mesotherapy type products that can be injected into the lines and wrinkles. You could also consider energy-based devices, so anything from Tixel to radio frequency microneedling to CO2 laser to nanoplasma. These are great treatment options for static wrinkles at the outer corner. So let's talk hooded upper eyelid skin. So if the hoods are sitting on your eyelashes, or you can't really see the upper part of your eye, the most long-lasting procedure you can have is a surgical upper lid blepharoplasty. This is also called an eyelid lift. It has about 10 days of downtime. It's a surgical procedure under a local anesthetic, but it gets rid of the hooded excess skin for a good decade. And if you're scared of undergoing surgery, then you can have any of these non-surgical skin tightening devices, from nanoplasma to Tixel to radiofrequency microneedling, and it all depends on the type of hood you have, the amount of bag you have associated with the hood, and where your brows are sitting.
It's bedtime for me now in Mumbai. We have time for one more question this evening. It's quite a good one because I get asked a lot when I do tear trough fillers, and that's how long do they last? Some people feel that they last a lot longer than we tell them, and some people feel they may have worn off a little bit earlier than we said. So Sabrina's going to explain to you why this is.
Hi, so I'm in a London black cab and I'm on my way home, and I thought I'd answer a quick question of how long do tear trough fillers last. So tear trough fillers last anywhere from 6 months to about 2 years, but you may feel that they're not lasting you that long because the plumping effect of the filler goes off approximately at 3 to 4 months time. So you may feel that the filler has gone, but it's still there, and you just may need a little bit of a top up sooner rather than later. So continuing dark circle InstaClinic Wassim, the nighttime routine is really important. So after a long day at work, make sure you've cleansed your face completely, a very gentle cleanser under the eye. Make sure there's no pollution and makeup left on your face. You can see my face is absolutely squeaky clean, and a great under eye cream, great facial serum, and managed to get a good 7 to 8 hours of sleep to keep the under eye area fresh.